fundraiser for the Children's Miracle Network is on the home stretch this hour. And as always, the goal is to enhance critical medical care for kids here in Kern County, but we can't do it without you.
Yes, Katy Harker is with us now. She is the Nursing Director of Pediatric Services at the Grossman Burn Center. Good evening, and thanks for joining us tonight.
Good evening, and thanks for having me. I'm really glad to be here.
Yeah, we're always happy to have you back year after year. And, you know, Katy, 40%, I know you're actually the Nursing Director, I should mention, at the Pediatric Services Grossman Burn Center. And I understand that 40% of all burn patients are actually children. So tell us about the complexities of treating burn injuries in children versus adults.
Well, that is a very big question. You know, treating burn patients in general is really challenging. These are patients and children who are healthy and they have this horrific accident that's happened, and they find themselves in the hospital.
Very traumatized.
Yeah. Very traumatized. And then the things that we do to take care of them, to treat their burn, are in and of themselves sometimes traumatizing, between surgeries and changing dressings and just all the things that come along with it. And so those nurses that work in that department are just excellent about walking children and their parents through that. Yeah. Because it is tough. And you know, I'm not one of those parents, but I cannot imagine what those parents feel and go through while their child is undergoing some of those therapies that we have to provide.
Such an emotional challenge.
Yeah.
And that's just part of the puzzle, the pediatric puzzle, if you will, that has been assembled in the last 12 years at the Lawrence Small Children's Center. Comment and just give us your thoughts on the evolution of Lawrence Small Children's Center over the last decade or so.
Oh gosh, holy smokes, it's changed a ton. When I came to the hospital in 2009, we were 12-bed pediatric unit, really small.
Right.
I think the NICU was already at their 31 beds, but it's just grown, and it's been so much fun to watch and be a small part of. You know, we've expanded our pediatric beds. We've added pediatric hospitalists that are there all the time to take care of children. We started a PICU. We have intensivists that are there all the time to take care of those critically ill children, and then burn came.
And all along the way, our viewers have donated money to the Children's Miracle Network and Lawrence Small Children's Center to purchase supplies for all of these facilities going just year to year. What do you say? What can you say about the sustained generosity of our viewers?
I mean, it's really overwhelming, I think, and it's very humbling. Their generosity and their support, I mean, we couldn't do what we do without it. Not only, you know, for patients and families, of course, because having to drive a long way when your kid is sick is really the worst. But also our staff, right? And our staff that love, our nurses and our respiratory therapists that love to take care of kids. It allows us to do what we love to do. And so I think that everybody wins and our community wins, really. So just humbled.
Absolutely. Yeah. Well, Katy Harker, thank you so much for joining us this year and all the past years. It's so great to see you again.
You too.